Dark side, light side. Nice. Next question is from Rosanna. Oh, yeah. All right. Um, Dr. Ben, thank you for all you're doing. Well, you're very welcome. I don't know, mostly talking, but yeah, sometimes that helps, right? Questions about vaccines that may help the virus, even though they've been developed to protect us from other ailments. Yeah, so this sounds like BCG. It is BCG. Okay, I'm thinking BCG, MMR, and polio. Yeah. I've been looking at the world data for hospitalizations and found that countries that administered the BCG vaccine to newborn babies up to 1974, which is the year I was born, yeah, have fared rather well. Yes, there are other people looking at that same data and coming to that same conclusion. It may not be as simple as A, B, C, but you know what? It might be as well. And trying it experimentally under controlled conditions is totally the way to figure out if this is a thing or if this is a coincidence. Yeah. um, because we're talking about different countries. And so different countries are usually going to go with different genetics and different climate and different levels of healthcare and different education and different just customs, practices, way that people deal with each other. And so there could be, I mean, yeah, there definitely are a lot of confounding factors, but you shouldn't ignore, a possible solution just because you can't be sure that it's the solution. What you should do is try it, and that's what people are doing. So the question goes on. Let's see. Even in Brazil, the devastatingly poor favelas, the death rate is not as high as it could be. Yeah, which thank goodness. Yeah, because yeah, I don't know. I was thinking about yeah that sort of situation. It just seems like an invitation for the virus to spread. And if there are people that society already doesn't care about that much, I mean, you could have deaths that go unreported. And yeah, the tragedy could basically be bigger than we realize. We tend to pay attention when certain people get infected more than others, perhaps. Yeah. So, why is it that in the U.S. an adult cannot go to a clinic and have the BCG vaccine administered? Oh, interesting. Yeah, okay. Um, yeah, it's a 100-year-old vaccine that's been given to billions of babies. Yep, those are true. Why can't I decide if I want it? Yeah, yeah. All right, all right. Yeah. So, thanks. Yeah. Okay. There are a couple research groups. So I know there's at least one in the US, at least one in Europe, and I think they're operating in other parts of the world as well. It's like this big consortium of essentially bacteriologists that are trying to save the world from COVID. And you know what? Yeah, fine. Thank you for your help, bacteriologists. There's even one here at Texas A&M that is doing this. And so what they're trying to do in each of these places, countries, regions is to do exactly what you say and give regular people, not even babies necessarily, I don't think. I think this is for adults as well, the BCG vaccination. So this is a vaccine against tuberculosis. It's the best we have. It's been the same for, yeah, 100 years or more. Pardon. It's not 100% effective by any stretch of the imagination, but it does seem to have some effect in most people. So it's actually a live bacterium that you take that's weakened, and this can potentially live inside you forever. But it is something that your immune system can just wail on, and so people tend to not get sick from BCG vaccine. And the idea is that it might reprogram the immune response. I'm saying those words as if they make complete sense. In my mind, I do not think they make complete sense. But the idea is that they're going to stimulate, I believe it's interferon gamma, which is going to make certain kinds of cells, like helper T cells, work a little more efficiently, find an easier path to get activated. That could work. That could end up setting off the right kind of immune response. I mean, I can imagine just as many scenarios where that sets off the wrong kind of immune response and makes things worse. But we've got the data that you said that so far it doesn't look like in countries where there is BCG vaccination, it doesn't look like there's a whole lot more virus. And so at least it's probably not going to hurt. And you're probably going to protect people against tuberculosis, or at least the worst effects of it. So yeah, overall, not bad. Why can't you get it? A couple reasons. Yeah. And you can now if you can find one of these studies and throw yourself to the front of the line and make sure you're included in them. Um, uh, One reason that they don't like to do that is because they do a skin test where they'll put a little bit of antigen under your skin, and if it balloons up, then that means you have antibodies or are making some kind of immune response against the tuberculosis bacterium, which means that you have been at some point and probably still are infected to some degree. Yeah. Thing is, after you vaccinate, you can do that test, and that super simple, easy test will show up positive, and it'll mean that you were either vaccinated or have TB. So they need other tests. They actually have other tests, and so there are other ways to do this. Thank goodness for modern science, right? So that shouldn't be as much of an issue. The other tests, I think, are a little bit more technological. They may be a little bit harder to do in some developing countries, but those are the countries where BCG is most widely used at the moment. So yeah, really, what are we worried about? Yeah. So I think it's a thing that's worth looking at. I don't know that it's the answer, but it may be an answer or a part of the answer. And like I said, the ceiling is who knows where. The floor is that some people will probably be protected against tuberculosis, and that's not a bad thing. So there we go. Thanks very much. Very good question. I'm glad you brought it. This is Ask Dr.